Loaded RN. If you're new to my channel, bienvenidos. And if you're one of my awesome subscribers, then welcome back. So before I get into my video, like I always tell you guys, don't forget to like my video, share my video, and subscribe to my channel. Like my video, share my video, and subscribe to my channel. Okay? And I just want to thank everyone for the support that I've received thus far. I know I've been slacking, guys. I'm trying to balance things out, but I'm trying to work on some goals and work and everything else. But I promise I'm going to do better with my consistency. So don't give up on me yet, okay? So this video today is not going to be about hair. However, I will say something really quickly because I've been gone for so long. So my hair is officially 3 months locked. And one thing that I will say I've noticed is that it's starting to get thicker already. Initially, I didn't feel comfortable having my hair down because I felt like it was too light, especially in the back. So that's why you guys always used to see me pin the back of my hair up. However, I am starting to get comfortable with having my hair down, and I feel like it's starting to thicken up. So I am enjoying the journey and my progress. Another thing that I'm going to say really quickly before we move off of the topic of hair is that one thing that my loctician and I was talking about the last time when I was there was the fact that my hair doesn't unravel. And I watched a few people's videos where they had to have their hair basically relocked. I don't mean just retighten at the root. I mean completely relocked, because with time, or I guess when they would wash it, their locks would loosen up. And so one thing that she told me is that a lot of people aren't getting their hair locked with the little, I guess, bump or knot at the end. This is one of my locks, and you can see here this little bump area that I'm talking about. So she said that they're actually the sister locticians are taught to do this, but for some reason some people aren't getting it. This is something, the bump will go away with time, but it helps to keep from having holes in your lock. So that's just a little FYI tidbit for you guys to keep in mind when you guys are getting your test locks, to keep an eye out for if you have that knot. Because since I've had my hair established, I haven't had any locks really unravel, except all the way in the back, like the little baby hairs. Sometimes they loosen up, but now that they're getting longer, not even those have loosened up this time around. So that's just a quick tidbit that I'm going to say about that. And then we're going to move into our next topic. And I'm super excited about this topic, you guys. Anyone that knows me knows that I love education, and I'm passionate about motivating others to excel in life. So this topic that we're going to talk about today is going to be a series. So this will be part 1, and then there'll be many parts to go building upon this topic. So the topic of this video is going to be, so you want to be a nurse. As I told you guys in my introduction video, I am a registered nurse, and I will be sharing tips that are necessary if you would like to become a nurse as well, or if you're considering becoming a nurse. I do have notes written down so that I will stay on course or on topic. So if you see me looking down every now and then, it's just me glancing at my notes, trying to make sure that I stay on top of all the things that I want to say. So the first thing that you're going to want to do, if you're considering to become a nurse, is to do your research. So before I even say that, let me say, first of all, I'm going to applaud you for deciding to pursue nursing. Nursing is an exciting career. It has many opportunities, endless opportunities. You're able to stay in your field, but move around, so to speak. And we'll talk about that later on. Just want to say welcome to nursing, and you will enjoy it. There will be things about it that you dislike, just like with everything else, but you will enjoy it, okay? So you want to be a nurse. The first thing that you want to make sure you do is look up accredited schools in your state. Now, what do I mean by accredited schools? You want to make sure that the school that you desire to go to is accredited. And this is important because the Board of Nursing often requires your school to be accredited in order for you to sit for NCLEX. So now imagine you go to school, you finish, you're successful, and then you go to sit for your boards, or you go to sit for NCLEX, and you find out that you're not allowed to test. At that point, your whole journey will have been in vain. Now, that's not saying that all programs that are not accredited, you're not allowed to take NCLEX. However, it is at the board's discretion. So to me, I feel like why even bother to put yourself in a situation that you might hear the words no after you've invested your time and your money? To me, I just think from the beginning, you should just try to look into picking a school that's already accredited. So that's the first thing. The second thing is you want to look at their first time pass rate. And this is important because this will kind of tell you, to give you an idea of how well this program will prepare you to pass the NCLEX successfully. Like I put emphasis on the first time pass rate because what actually makes a school accredited or their reputation build or excel is the fact that they're able to have their students pass the NCLEX the first time around. They don't really care if it took you 3, 4, 5, 6 times to pass the NCLEX. What everyone wants to know is, did this program help you pass the NCLEX on the first time around? So when you look it up, you're going to see a percentage. You'll see, I think anything above a 75 is what is required in order to remain accredited. However, of course, you want to go higher. If you could get 80s, 90s, that's ideal. So a program has, I want to say, 2 years in a row to get below a 70 before they lose their accreditation or before they go on probation. So that's just some things that you want to make sure that you're looking into while picking your program. So, we talked about accreditation being important. And so you want to make sure you do your due diligence when you're looking at your program. Like I said, you could look on Board of Nursing for your state. That will probably give you the most accurate information about what programs are accredited. The second thing you want to do is decide what type of nurse you want to be. So nursing is really interesting because there's so many different branches that one can choose to go through. And sometimes that makes it a little bit confusing. Let's say, for example, lawyers, although there's different types of lawyers, there's normally one process that you would do education-wise in order to become a lawyer. You'll go to college, you'll get your bachelor's, then you'll go to law school, and it's pretty much the same. Same thing with becoming a medical doctor. You will go to school, you'll do a pre-med major to get your bachelor's, then you will apply for medical school, then you go to residency, and you become a medical doctor. With nursing, there are different avenues that you can go through to still be a nurse. So the first thing that you can consider is becoming an LPN. An LPN is a licensed practical nurse, and the school that you'll attend is a vocational school. This program will probably be 1 to 2 years, depending on the program. And a licensed practical nurse has a license, and they're able to accomplish many duties in nursing. They can give meds, they can do NG feedings, they can do wound dressing. So what you cannot do as an LPN is administer IV medications. And when I say administer IV medications, I mean things that are IV push, or even, in the hospital to hang IV medication. You can flush an IV, but you cannot administer IV medication. And you also cannot do what we call EAT. Now, when we were in school studying for our BSN, this acronym EAT was used to help us remember the things that you cannot delegate to an LPN. EAT stands for E is evaluate, A, assess, and T is teach. So E, you cannot evaluate a patient or their condition. A, you cannot assess. When I say you cannot assess, I'm going to give you an example. Let's say, for example, you work for home care and there's a new patient that's coming to an agency. The first person that will have to see that patient has to be a registered nurse. That registered nurse will have to assess the patient and make a care plan or treatment plan. Then from there, the LPN can maintain the patient or see the patient on a daily or weekly basis based on that care plan that the RN created. And the last thing, teach. You cannot teach a patient anything. For example, if you work in a hospital and it's time to discharge a patient, or you're going over a procedure, you won't be able to teach them. That would be the RN's job to teach. Okay? So I hope that gives some clarity about the differences in the roles of an LPN. Next thing that you have to know for LPNs are that the setting that you work in is a bit limited. And when I say limited, it all depends on what your ideal setting is that you would like to work in. Most hospitals don't hire LPNs at this point in time. So if you do become an LPN, ideal settings for you will be like a clinic, nursing home or long-term facilities, assisted livings, home care. Those will mainly be your options, or a school also, like a school nurse will also be another option for you. So now let's move on to registered nurse. There's two options with a registered nurse as well. You might hear some people say they have their associates, and you might hear others say they have their bachelor's. So what's the difference? Is a bachelor's even worth it? Is one better than the other? So we're going to get into it. So your associates in nursing is, it is a degree that you get, but it's an associate's. You get it from a community college. So once you're planning to attend a community college, you already have to know that you're going to be getting an associate's degree in nursing. So it takes a total of 3 years. I know many times people kind of gravitate towards that option because they hear that it's only 2 years. The nursing program itself is 2 years, but you still have an additional year for your prerequisites. So it's a total of 3 years that it will take you to get your associate's degree. You're able to do everything that a RN that has their bachelor's can do in the hospital. I know that it goes back and forth. Sometimes there were times when I was hearing that associate prepared nurses weren't being hired in the hospital. They wanted all the nurses to have their BSN. And then I think because of the nursing shortage, they went back to saying that they would hire nurses with their associates. However, they would have to complete or accomplish their BSN within a year. So you can work in a hospital, but depending on the hospital, some might be pushing you to still go back and get your bachelor's. Some might be okay with you having your associates. The pay difference is honestly not much. I've worked at some hospitals that only paid their bachelor prepared nurses 25 cents more an hour. However, ideally on the resume though, it probably does look better to have your BSN because it is a higher degree. So it looks better. Okay, so now for your BSN, that you would acquire from going to a university. So that's going to be 4 years. You're going to take 2 years of prerequisites and 2 years of the nursing program. Another thing I want to say that if you get your associates in nursing, you can do a bridge program that will be at 1 additional year for you to get your BSN. So you can do your associates in nursing, complete that, start working, and then do a bridge program to do 1 more year to have your BSN. So you'll still end up doing the same 4 years to get the same degree, basically. So it's a difference of breaking it up or just doing it straight one shot. So the difference really for the associates in nursing and the BSN is that the BSN incorporates a lot of management classes and leadership classes and ethics. Basically, it allows you to be prepared for leadership positions as a nurse. If you're going to become the director or the nurse manager, they're going to want you to have your BSN. So that would just give you more emphasis on being a leader, where the associates might give you more the clinical aspect, such as pathophysiology and mental health, and the classes that you take in your BSN as well. However, you might not take the leadership classes. So when you go back to do the bridge program, those would be the classes that you would have to take during that year, and a few other classes. I can't think of them off the top of my head. So after you figure out what works best for you, and I say what works best for you because you have to choose what path you want based on what's ideal for you and your circumstances or your situation. You might be a mother of 3 kids or a single mother, and you're like, okay, for me to dedicate 4 years of going to school full time, at this moment, I don't see myself being able to do that. I need to work while I'm in school. So you might decide, okay, let me do LPN first, and then I will work my way up. That's an option for you. You might say, let me choose associate's degree, and then while I'm working as a nurse, I'll do this at nighttime. I'll take classes and I'll finish up my BSN. That works for you. Or you might be in a situation where your job is willing to pay for, let's say, your associates. So now out of pocket, you just got to turn back and do your BSN yourself. That's an option for you. For me personally, my situation was a little different because I had my bachelor's degree in biology already because I was planning to go to medical school. So I had my bachelor's of science as a biology major. So when I decided to go to nursing school, I pretty much had all my prerequisites done. So I was able to get my BSN and only go to school for 2 years. So for my situation, that worked for me. So you just have to sit down and weigh out all of these options and decide which one works best for you. After you decide what program you want to pursue and what school you want to attend, and you make sure it's an accredited program, the next thing you want to do is meet with your advisor. You want to make sure that you go over what classes are required in order to apply for the nursing program. You don't want to waste time taking classes that aren't needed or classes that aren't approved, and then the time comes and you want to apply to the nursing program and you find out that you need to take another year, another semester of prerequisites. Time is money in school, so you want to make sure that you're not having to backstep to do things over, to do things the right way that you could have done the first time. So for example, I know that most schools require 2 semesters of anatomy and physiology. Most schools require 2 semesters of chemistry. You normally have to take algebra. And then they might, depending on the school, they might require history or a language. There's different things that different schools will require. So that's why it's really important that the minute you decide you want to become a nurse and you want to go to that program at that school, you find out what's necessary in order to apply. What GPA do they require? Do they require you to have at least a 3.0 in order to apply? You got to keep that in mind because you don't want to be taking classes and you're like, man, it's not a nursing class, so I'll just, play around and who cares as long as I pass. Because when the time comes to apply, there's going to be lots of other people applying and they're going to choose based on your grades, based on how you test to get in. It's going to be on a different factors, but your GPA is definitely going to be one of them. So you have to keep in mind from your first class that you take that you want to aim for getting nothing less than an A so that you remain competitive. Like I said, there's different factors, but the GPA will be one. So that's something that from your first class that you enroll in, aim to get a good grade. Aim to get A's because that will also carry you, that GPA will carry you for nursing school so that when you finish with a strong GPA as well. That was one thing that was a challenge for me, that because all I took was nursing classes, all that I had to reflect for my GPA from that school were my hard nursing classes. I did end up with a 3.0, thank God. However, there were others who graduated with higher honors than me, and that's because they took their prereqs there. So they took gym, they took history, they took, all of the easy prereqs classes, and they got A's in those. I transferred those in from my other previous degree, so they didn't count towards my GPA. So that's just something that I want to pass on to you to make sure that you know. Before I end my video, I also want to say to you that you're deciding to do something that is very challenging. Nursing is one of the hardest degrees to pursue. Nursing is one of the hardest licenses to get, but it's the easiest to lose. I remember someone saying that to me, and it's the truth. I remember going to our before the classes started, we had something called boot camp. And it was truly a fitting name, boot camp, because it is a journey. It's like a military journey that you're gonna be pursuing. You're gonna be broken down to be built back up. So you want to make sure that you're preparing yourself mentally for this journey that you're gonna pursue. And you want to keep in mind that I don't think life ever waits for the perfect time for you to decide to go to school, at least for me, and especially if you're not a traditional student that's going straight out of high school. If you have life, if you have responsibilities, you have children, you're married, you have rent to pay, you have a mortgage to pay, you have a car note, life won't stop and become easier for you to go to school. So you have to make up your mind from the beginning that it's going to be by any means necessary. I'm leaving this school with my degree. So I don't want this to be a long video. Like I said, this will be a series. So this is just part 1. You have to tune back in for part 2, and then we'll be talking about the other factors that are considered in order to be accepted into the nursing program. We talked about GPA, but there are other things that you need to prepare and keep in mind that you will need as well when you go to apply. In other parts, we'll also discuss how to study for the nursing program once you get in. Then we're going to talk about once you complete the nursing program, how to study for your NCLEX and be successful the first time around. We're going to talk about applying for jobs, deciding what specialty you want to go into. We're going to talk about the options that you have for jobs. So I'm super excited to embark on this series with you guys. And if you have any questions, please feel free to comment below, and I'll be sure to answer your questions, whether in the comments or in the next video that I post. Like I said, I know I've been gone for a while. I'm going to work on my consistency, so don't give up on me. I hope this video was helpful to you and that you were pumped up and excited about this journey, because I'm super excited for you. Okay? Stay tuned.